Good morning, everyone. Michael Harlan here with Senior Benefits Alert. If you're on Medicare, you've probably noticed something in your January Social Security statement. The Part B premium went up again. A lot of you are feeling that sting right now. But here's the thing. I have some genuinely good news to share today that most channels aren't talking about yet. In 2026, Medicare is a story of two very different directions. Premiums are rising, yes, but for the first time, prescription drug costs for some of the most expensive medications are dropping dramatically, 50%, 70%, even 80% in some cases. Today I'm going to give you the full picture, the increases you're seeing, who they affect most, and the major drug price relief that could save many of you thousands this year. Stick with me, this is important. Let's start with the part most people are upset about. The standard Medicare Part B premium for 2026 is now $202.90 per month. That's an increase of $17.90 from last year's $185. For most of you watching, this premium is deducted automatically from your Social Security check, so that $56 average COLA raise many expected suddenly feels a lot smaller. This increase was finalized by CMS in November 2025, and it's hitting statements right now in January. It doesn't stop at the monthly premium. The Part B annual deductible, the amount you pay out of pocket before Medicare starts covering doctor visits and outpatient services, is now $283, up $26 from 2025. Part A hospital deductible also rose slightly to $1,736 per benefit period. And if you have a Medicare supplement or Advantage plan, some of those premiums have gone up too, though that varies by plan and state. Not everyone feels this the same way. Lower-income beneficiaries on programs like Medicaid or Medicare savings programs often have their premiums covered, so the increase doesn't touch their check. Higher-income seniors may pay even more through IRMA surcharges on top of the standard premium. But for the majority, about 70% of us, these higher costs come straight out of Social Security, shrinking that COLA raise we were counting on. I know this part is frustrating. But stay with me. The next part of the story gets a lot brighter. Here's where 2026 becomes a turning point. Thanks to the Inflation Reduction Act, Medicare has now negotiated lower prices directly with drug manufacturers for the first time ever. Starting this year, 10 of the most expensive and most used Part D drugs have dramatically reduced prices, some by more than half. Even better, the new $2,000 annual out-of-pocket cap for Part D prescription drugs is now in effect. Once you've spent $2,000 out of pocket on covered drugs in 2026, not counting premiums, Medicare picks up 100% of the cost for the rest of the year. No more donut hole surprises. This alone is expected to save millions of seniors thousands annually. Let me show you the actual drugs and savings. These are the first 10 Medicare negotiated in 2025 for 2026 prices. Eliquis, blood thinner, down about 50%. Jardiance, diabetes, down 60%. Xarelto, blood thinner, down 60%. Januvia, diabetes, down 70%. Farxiga, diabetes/heart, down 70%. Entresto, heart failure, down 50%. Enbrel, arthritis, down 60%. Imbruvica, cancer, down 80%. Stelara, psoriasis/Crohn's, down 60%. Fiasp/NovoLog, insulin, down significantly. If you or a loved one take any of these, your copays just dropped, sometimes from hundreds per month to tens. And for insulin users, the $35 monthly cap on covered insulins remains in place. No increase there. That protection continues strong in 2026. If your income is limited, the Extra Help Program, Low Income Subsidy, now has higher eligibility limits in 2026. More people qualify for little to no drug copays. Check Medicare.gov or call 1-800-MEDICARE to see if you're newly eligible. So let's put it in perspective. The average Part B premium increase costs about $215 extra per year. But for seniors taking one of these top 10 drugs, savings can be $1,000 to $6,000 plus annually, far outweighing the premium hike. Even with the $2,000 cap, many will hit that early and pay nothing for drugs the rest of the year. For the first time in decades, drug costs are moving in seniors' favor. Here's your action plan. Log into your Medicare account at Medicare.gov and review your 2026 Part D plan. Make sure it includes these negotiated drugs at the lowest copay. If you take one of the 10 drugs, talk to your pharmacist about the new pricing. Savings started January 1st. Check eligibility for extra help or Medicare savings programs. They expanded in 2026 if IRMAA is hitting you. See if you qualify for an appeal. So yes, Medicare Part B premiums and deductibles are up in 2026, and that hurts. But the prescription drug relief, the negotiated prices and $2,000 cap, is historic and helping millions more than the increases are hurting. This is the first year we're seeing real downward pressure on drug costs, and it's only going to grow. You've earned these benefits. Make sure you're getting every dollar of relief available.